questions regarding the vaccines and the immunity part. What vaccine at the moment holds the most promises, and how far are we away, or how far are we from getting vaccines to the public, you think?
Yeah, so again, quoting my colleague Rishi, just as an infectious disease expert, his answer, in a new study, remdesivir was given to a patient in New York, and we saw some treatment improvements within 2 days. Again, this is Rishi. In my opinion, this vaccine, originally created to treat Ebola, has the most promise right now. A more effective vaccine is expected within the next several months to a year. So I do want to highlight that timeline. Dr. Fauci has been talking about this regularly, for those of you that are listening to his briefings in the news. Vaccines take a while to develop and to be proven to be effective. And so I don't think we're anywhere close to a vaccine yet. We're talking months to a year at least, at the very least, in my opinion. And I think that opinion is shared by a lot of infectious disease specialists, because we want to make sure not only that it's safe, but that it works, and that we can develop enough doses of that vaccine and distribute it, not just nationally, but globally to the population, to the world's population. So we're quite a ways away from that super effective strategy to reduce this global pandemic. But I know that people are working in lightning speed to try to develop it as fast as possible. When that vaccine gets developed, it will be the world's fastest developed vaccine in the history of humankind, but we're not there yet.
So still the precaution is the best cure still. So we don't have any cure yet. So precaution is what we all should be following. So regarding this vaccine, as you gave the timeline, and that is what we are hearing from CDC and from Dr. Fauci and everywhere, that still it's months away, even the fastest that could be done, as you're saying, in the history, if it comes out sooner. But so we don't have vaccine yet. And we see it going to take months or maybe a year before it comes. So now with regard to reinfection and immunity, do we know yet if getting coronavirus and surviving it means that you are now immune to this disease, or there's a chance of reinfection like in the case of flu? And associated to that is a very debated question is about herd immunity. How can we ever develop herd immunity if we remain locked down inside? So should we just let people go out and get exposed, and who develops, and if not, then what is your take on that?
Yeah, lots of questions there. Let me just I'll try to answer them all. If I didn't answer them, ask me again, please. So first one is around the herd immunity. I'll answer the last one first. As we've seen with countries that were slow to initiate lockdown, the number of cases of coronavirus rose exponentially, rapidly, and then it overwhelmed the health system capacity to care for those individuals. So run out of respirators, run out of ICU beds, run out of enough healthcare providers to provide for this huge onslaught of patients that are all developing the disease. So yes, if we did that, if we allowed people to go out in the public, we would see a rapid increase in the number of cases, and then it would peak at some point, and then it would drop down. But then we'd lose a lot of human lives, and there would be a lot of unnecessary suffering as a result. So on the scale of a human herd of the global population, to me, it does not make any sense to just let everybody out there so we can just get it over with. There's much smaller examples in human history where if a kid got smallpox, you would sort of bring in other kids in a human household so that all the kids would get it. We are not doing that at all at this global pandemic level, because the loss of human life would just be huge. It's already huge. So we are doing all of the social mitigation errors, or flatten the curve, as we've heard over and over again, is designed to keep the capacity of the health systems to treat all the people who get the virus successfully so that they can survive it and not die. So that is exactly why we should be listening to our public health officials and doing all of the recommendations in our local areas to keep everybody as safe as possible. Now, you asked a couple of other questions and I don't remember them all. So
no, I think that was the main one. Regarding the herd immunity, I would want to come back.
Right. So this is another one where I would defer to to Rishi's expertise. So on the Osmosis COVID landing page, Rishi has been doing a daily podcast, and he answers some of these questions. And he has an example where he specifically answers this specific question. Having watched his video, what he talks about is when people have been exposed to coronavirus, they will then develop antibodies that will demonstrate that they've had the virus and been exposed to it, and their body now has, their bloodstream now has antibodies to demonstrate that they've been exposed to it. At least in the studies that he's quoting in that, we don't yet know whether it's once and done. I've had the coronavirus, hooray, I can now walk freely and not worry about getting reinfected. So it's just too soon for us to tell, because this virus is so young in human history. We don't have enough length of time to see anybody get reinfected and then demonstrate that, in fact, they were or weren't immune to, like you said, like the flu, getting it again. So time will tell us that fact. The early studies that we've seen so far suggest that if people had antibodies and then got sick, it could have been that the test was erroneous, meaning that we thought they had antibodies, but it turned out that it was a false negative test. Got it right? No, false positive test. That they thought the antibodies, but the test was wrong. And it turns out they didn't have antibodies, and then they really got sick later. So we just need more time and more studies to confirm with certainty that somebody, once they have antibodies, is truly immune from the disease. Until we get that vaccine down the road, we still don't know yet.
Right. And I think that's what exactly, like, as the Dr. Fauci always quote, is like the virus will tell us that. It's like right now it's too early for us to, and we don't have enough time to give you the timeline or how it acts or the nature and everything, because it's a novel virus to us. It takes time for, to study it. And so right now it's more in control of the virus than us humans, or the specialists like you and other specialists is like the virus. So again, coming back to, I think, the point about precaution, because I think we want to emphasize, as being a healthcare platform, that precaution or the guidelines that is being given by your local, your government or the CDC, follow that, right? The precautions is really something, even if eventually, I think because of various factors about economy and everything, things may have to open up even before the vaccine comes available. But even if you do, don't take it that things are gone or that everything is back to normal. We still have to be very careful and with precaution do our daily activities. So with that, about the virus, as this virus is really something has made all the world, upside down. So our viewers, which might be basic for you, very basic, but they have a question: does the temperature of 56 degrees Celsius kill the virus? And what exactly will kill the virus on a surface and inside a person? And why is it so difficult to kill this virus?
Yeah. Okay, so all viruses are hard to kill, just sort of by the fact that they're viruses, just almost by definition. I would just say that the way viruses work and the type of infectious agents they are, as let's say compared to bacteria or other types of things that cause infectious diseases. In terms of the temperature, I must say I don't remember, because I just would have to reread on that, and I don't want to mislead your readers about exactly 56 degrees, but generally higher temperatures, like when we boil water, we're killing any sort of infectious things that may be in it. So that is definitely a mechanism to reassure us that things are safe, liquids are safe. Why is it hard to kill the virus inside a person? So the way that viruses work is that they insert their DNA into the DNA of the cells that they infect. And so the way viruses work, like the HIV virus, for example, is that mechanism of penetration into human or animal hosts, and then making multiple copies of themselves, and then sort of sneaking out of the body, in this case as a respiratory virus, through those sneezes and coughs and respiratory droplets. And so that's what makes it so hard to kill viruses, is actually the basic science, or the way that they do their thing. Their job is to replicate and produce more of the copies of themselves, and they've figured out how to do that, and sort of we are these unwilling hosts of it. Again, through our Osmosis coronavirus landing page, we've got a lot of instructional videos or informational videos that explain to people how the viruses transmit and what you can do to maximize your health and minimize your risk. The coronavirus is one of many viruses. I mean, we have colds every year. We haven't figured out how to stop the cold or stop the flu. That's just the nature of viruses.
Okay, and I think we would tell our users, as that Osmosis, just to bring to the Osmosis, that it has a lot of educational and informational material, especially very much devoted to the current pandemic, which Dr. Azzam, Dr. Rishi, and other specialists in Osmosis have created with their research. So definitely, we will provide the link to our users at the end of the podcast to visit that and you know. Make use of that information provided by the specialist. Now, coming back to our questions on mental health, because this pandemic is not only weighing heavily on the public health and economy, it's also impacting our mental health. And audiences has questions on that. And the first on that is, can just the thought of getting infected by COVID-19 and fear of dying cause hallucinations and mental anxiety and stress enough to kill you or lead to a psychiatric admission?
Yeah, thanks for bringing this to mental health. It's a real concern in addition to the the pandemic. Yes, there's going to be a surge of mental health concerns. There probably already is in terms of people's psychological and mental health and well-being. I would suggest that there are lots of things that people can do to reduce the impact of those psychological distress or that anxiety, if you will. The concrete question that your user asked around, can it lead to hallucinations and to a psychiatric hospitalization? In extreme cases, perhaps yes, but if we do all the right things to reduce the chances of that, to sort of take good care of ourselves outside of the hospital, then ideally you won't get so bad that you need to be hospitalized or in an inpatient psychiatric hospitalization. And so, the key here is to be able to talk about and to reduce your anxiety in order to prevent that from happening in the first place. There's lots of tips I have on how we can go about doing that if you want me to discuss those.
Yeah, and actually, that was our follow-up question on that. Is the viewers want to know what kind of anti-stress or relaxation methods they, would you recommend them to help cope up during this time? Because there are people who are with families, which has a different set of stress of, feeding the family, taking care financially. Then there are a set of people who are single. They have a different set of stress level of being single and lonely, social distance. So what kind of some what you call it, the methods or tricks do you tell them to cope up with this situation?
Yeah. So I'll come back to the videos of the Osmosis just because I've already discussed those on video. So on our Osmosis YouTube channel, we've got some videos that you can just look up my last name and you'll find some tips on how to maximize psychological well-being in an era of social distancing, but so available to your listeners as well. I'll just mention a couple of them here. The first one I want to suggest is even before the coronavirus pandemic, each of us had some awareness of how stress manifests in our bodies, right? So thinking, how do I react to stress? Concrete example, I know in my own body, like I develop lower back pain when I'm stressed. So I need to in order to prevent me from having low back pain, I need to be aware of that and then do everything I can to prevent that. So I'm doing a lot more stretching these days of my back when I'm in front of my computer. I'm doing some sit-ups to strengthen my stomach muscles so that way the muscles in my back are stronger or have that counterweight. So each of us should be thinking, how does stress manifest in my body, and what do I do that helps me reduce that stress? Another concrete example is talking about the stress with other people. So talking about your stress is not actually going to increase the stress, it's going to decrease the stress. If you will, talking about your feelings helps you address and process them so that way you can manage them better. There are lots of apps out there. There's lots of resources that people can use to find ways that work for them. At my own academic department of psychiatry, as you mentioned, I work at UCSF in the Department of Psychiatry. On our department website, we have a list of reliable mental health resources to reduce stress and maximize well-being. So that's a resource I encourage. UCSF.edu is the UCSF's website. You look up Department of Psychiatry and you'll see resources to maximize well-being during coronavirus. What I've been telling people, and I'm telling my own patients, is just because we're socially distancing doesn't mean we need to socially isolate. So even in a time when we cannot be close physically to other people, we can use the telephone, we can use the video conferencing to bring us together with people that we love in ways that don't spread the virus, but ways that maximize building communities, right? So if you've always thought, oh, I should be calling my mother more, well, this is the perfect opportunity to be calling your mother more and reconnecting, or other loved ones. There's other strategies that I know a lot of people are being very creative around. So Zoom meetings or other video conference meetings with family or friends or loved ones, video socializing. So those are ways that you can increase your social connectedness even whilst maintaining social distancing. So there's some tips that I would offer up offhand.
Yeah, and thank you. And I mean, just to recap the two ones that you just talked, I mean, I think, and that's very interesting even to listen to your body, which I understand like that, because the body tells you, manifests you physically the stress level, because sometimes we think like stress is like, it's like only to your mental thing, but it does reflect into physical state. Listen to your body. And at a very personal example that you gave is like, when you know that this is related, the physical pain or physical signals are related to your stress, do physical exercise or something to calm that down or to at least minimize it. And then the second one that you said is about talking, because I think anxiety, depression, and all these mental issues are all being a kind of still a little, obviously this is not, we'll call as a stigma, but talking your mental problem is considered still like, are you weak enough to handle yourself? Why are you talking, So, but I think what you point is like, talk about it, because it doesn't increase, it decreases, because you can then hear, and I believe like acknowledge it better, and then, find the ways. Is that
Yep, two
something?
examples, totally. Again, with my own patients, I talk about a metaphor I like to use is pressure cookers. So if you're used to a pressure cooker, it's sealed, and when it's on the stove, it's letting off steam little by little. Think about that pressure cooker as your skull. Think about the steam as your emotions, and the fire underneath is external stressors, right? So we can't control the external stressors. Some things we can, some things we can't. So that fire is way up now in the global pandemic. We have our emotions that are triggered by that. We can't control the skull, but we can control talking out or letting off emotions little by little, like that steam valve, because if we let it out little by little, it doesn't build up and explode. So it's a great way to think about how we must process our emotions so that we can live as physically and mentally healthily as possible. Second metaphor is airplane oxygen masks. So when you're traveling, when you used to travel, if those of you that traveled on airplanes, and they'd say if the oxygen masks fall down and you're traveling with someone who needs assistance, make sure to put your mask on first before helping others. Perfect example of how we got to take care of ourselves so we can take care of others. So even if you think that talking about your emotions is a sign of weakness, it's not. It's a sign of strength. So if you process your emotions, you can then help the people that you love to help them take care of their emotions as well. So in fact, it's absolutely a sign of strength to talk about our feelings.
I love the metaphor of pressure cooker. Love that. I mean, obviously, in this case, the fire behind, is underneath is the coronavirus, which with a high flame. So wonderful. Thank you. It seemed related to that, but it's more about the social plans. So a few of our viewers have the same question asking regarding the special plans. So people have special plans that have been canceled or postponed, like graduations, weddings, baby showers, etc. And individuals are feeling an overwhelming sense of sadness and even depression. So how do you recommend they cope up with this? Because some of these are like very social. You need people to be together and, celebrate this stuff as the human race has been doing all this time. And now because of this, we are like, cannot do it. So what do you would recommend or give the tips to cope up with this kind of situations?
Yep, great question. I'm going to give you two personal examples, and then those are generalizable to all of your viewers. First one, my daughter just turned 14. No birthday party, can't do it. We're all socially isolating in place, or sort of sheltering in place. But that doesn't mean we couldn't have had a video birthday party. So we did. Like, her girlfriends got to sort of be in their own homes, but we did a little video party, and we lit candles at our own homes so that we could say happy birthday to my daughter. Second example. baby shower. I know some relatives that are expecting their first child. Coronavirus didn't time when the pandemic was going to happen according to when that baby is going to be born, but they still hosted a baby shower. Again, a remote baby shower. Everybody was all over the world, wherever those people were, but they managed to pull off a remote baby shower where individuals were able to introduce ourselves, and we did some baby shower games on the video conferencing thing. So it requires some creativity to think about how are you going to pull this off, but it doesn't mean you have to abandon completely those special life events as best you can. So what I would encourage your listeners and viewers and users to think about is, what are the key elements of this special event that I want to retain? And how can I pull that off while not being in the same room together with these loved ones, right? So absolutely people are postponing weddings, or even actually if they don't want to postpone it, having remote weddings where not everybody can be physically present, but that allows you to continue celebrating and honoring those life important events in suboptimal, but still feasible, viable ways. In other words, next best thing, like we can't let perfect be the enemy of the good enough, and we got to let the good enough be as good as we can make it in the local context. So those would be some generalizable principles for everybody to think about. So what are the key things I want to retain? As an example, there are people who are in, even before the coronavirus, they want to make it to their daughter's wedding and they've got a terminal illness. Well, all right, if you're too sick to travel, can you have a little bedside wedding ceremony that is witnessing my daughter's wedding, even though she's going to have another wedding after I'm dead and gone, right? So that's another example where let's do like this version now, and when the coronavirus eventually ends, then we'll have our second wedding or something like that. So we got to be creative, but I think there's lots of ways. There's no, how do I put it? There's no upper limit on human creativity.
That's very true. And I think very well that you pointed those, the points is like, you don't have to completely stop being together in a way, like socially or, as you said, social distancing we have to do, but not social isolation. So we can still be together in the feelings and, celebrating things. It would be more in a distant or more on online, which I think is a blessing. It's in a way that because of technology, getting a coronavirus or pandemic like this in this era, we are still very, very good. Or think, what if we have got it 30 years back? Or 30 years.
Flu, right? Or that Spanish flu, like the technologies did not exist that year compared to the ones we have here. Now, I want to acknowledge not everybody has access to technology. So certainly not everyone has high internet bandwidth or high quality computers that allow video conferencing, but telephone penetration and cell phone penetration in a lot of the world is pretty high. And talking to someone, old school talking to someone, actually, you can hear the love in their voice, even if without spreading that virus.
Exactly. Love without spreading the virus. That's such a good line. So we did take care, or you took care a lot of important concerns that our audiences had. So thank you so much, Dr. Azzam, for joining and taking so much of your time to answer these questions from our audience. And if you have any closing points or tips to give to our audience in this pandemic.
Yeah, I think that we're all in this together, one global humanity. And please continue to follow your local guidelines. We are flattening that curve, but it also means we're spreading it out, the curve, meaning it's going to take longer for us to get to normal, whatever the new normal is going to be. But the more that we all take care of others, in addition to taking care of ourselves, the more we think about the global human family, the better we will survive this pandemic together. We're all going to get through this together if we make sure to continue to practice good hygiene, good social distancing according to local guidelines, so that way we can all survive this together.
Wonderful. We are in this together. That's fantastic. Yes. Closing this, I want to thank you to our audience for tuning in, and stay tuned to some more answers from Dr. Desai following this closing. And remember to download free MediPocket app to get your free discount card and bring saving on 80% on your medications, on the pet and also on the human medications. And MediPocket is your all-in-one solution to fit in your pocket. Stay safe and have a wonderful day. Thank you.
Thank you.